The following program is rated NS for nursing students only. Enjoy!
What's wrong?
Mom, are you
Can't
okay?
seem to breathe right.
Same
Can't catch
thing.
my-
Just do it. Just breathe.
Well, I mean, I'm trying, honey.
Do you need help?
I think I need to sit up a little
Do you want me
bit.
to call someone?
I think
Maybe.
we need the nurse.
Okay, we'll call the nurse.
Can I
Nurse,
sit up?
do you need help?
Can I sit up?
You need to sit up?
Yes, please.
Yeah, go ahead, do it.
Okay, well, can you help me, honey? I'm very weak.
Come on. There you go. All right.
Hi, Miss Smith. My name's Hannah, and I'm your nurse today. And this is Rachel. She's our nurse orientee training with me. Hello. What seems to be
What
the
is she
problem?
doing?
She's training. She's new.
Why are you doing that?
I can't breathe, I told you.
What
Cut
are
her a little slack.
You're having difficulty breathing?
Yes.
How long has this been going on?
It just started again.
Do you experience shortness of breath while you're resting or just with activity?
Both with activity is worse.
Okay. When was the last time you were hospitalized for your COPD?
A couple weeks ago, but I left early because I wanted to get some fresh air, and you guys wouldn't let me get fresh air.
You wanted to get fresh air. Okay, I'm going to ask you a couple questions about your tobacco use. Are you a smoker?
No.
Have you ever smoked before?
Long time ago.
A long time ago. Okay, I'm going to take a listen to your lungs.
What are you listening for when you listen to her lungs?
When you listen to their lungs, you want to listen for any audible wheezes, bronchi. Okay, I'm going to listen to your lungs.
Okay.
Deep breath in.
Ew.
Shut up.
Another deep breath.
Can smoking cause this?
Smoking is the number one
I
cause
think I'm
of
hungry.
COPD.
I think I'm hungry. I don't think we should need to be talking about that because I don't smoke, so it doesn't matter.
But she does smoke. She's
Okay.
lying.
I told you not to tell you.
She smokes a lot. Our whole family smokes.
I don't.
Yes, you do, Dad.
How long have you been smoking?
About my whole life.
Your whole life. Okay. Can you tell me about how many packs a day you smoke?
About 2.
Okay. As mentioned before, smoking is the number one cause of COPD, and smoking can exacerbate COPD, which could be the cause of your recent hospitalizations and your inability to breathe. Okay.
She's breathing fine.
This
Well,
is how I breathe all the time.
okay.
used to
Well,
it.
we're gonna do some more assessments, and we're gonna try and get some treatments and diagnostics just to see where your COPD is at. I'm gonna have my new nurse listen to your lung sounds on your back so she can hear what it's like. Can you take a deep breath for me?
What are you listening for?
Well, there's definitely some wheezing in there from the constrictions of her airway, but we'll have to have the doctor listen further.
Okay. The next thing we're going to check is her AP diameter. If people with COPD tend to have a barrel chest appearance, and that's where the diameter, it's about the same, like a barrel.
Okay.
So what would you say about hers?
I would definitely say she has a barrel chest. It is a little more rounded in front than we normally see.
That's caused from the overinflation of the lungs because the alveoli are not able to be as elastic as they once, so she cannot expel her CO2 as easily.
Is that going to happen to me too? I'm a smoker.
The
Is that going to happen to Dad?
No. Is it?
The best way to try and prevent COPD is to quit smoking, and there are many resources in our community that can help you with that. You can do nicotine gum, you can do a patch, even hypnosis sometimes works.
Oh, I ain't doing none of that. That's crazy talk.
Okay, and And then I'm gonna check your fingers. And I'm just gonna check your refill for circulation because COPD can also have an effect on your circulation.
I noticed she has clubbing on some of her fingers. That's one of the side effects, correct?
That's also a sign of COPD, that is correct. Clubbing of the fingers.
Can I take this thing off yet?
I was just gonna ask, does she have to wear that all the time?
The oxygen does help her breathe a little better and keep her O2 stats up. Her pulse ox is currently statting at 89%.
Is that good or bad?
Actually, for people with COPD, we don't want it at 100%
Okay.
because if it gets up that high, it's going to cause her body to not want to breathe.
Mm-hmm.
So we like to see it anywhere between 85 and 92%.
Okay, so when she goes out, I noticed she hasn't been wanting to do that lately. Does she have to use it at all times? Just she doesn't really like to go out with it, and I want to make her comfortable.
At this point with her COPD, she is probably going to have lifelong oxygen
Okay.
supplementation. But there are also resources like portable oxygen tanks that can make it possible for her to go out. And
I'm
The
too
doc-
weak to be carrying anything like that.
Oh, I got you.
Okay.
weakness and fatigue can also be cause of COPD because of all of the extra muscle usage and lack of oxygen. Your doctor will be in to discuss some diagnosis or like diagnostic tests to see exactly where your COPD is at, and from there we can go with treatments. Some of the diagnostic tests that your doctor might recommend is we'll do a pulmonary function test. We can do a chest x-ray to take a look at your lungs and see if there's anything in there such as fluid causing pneumonia, which can make your COPD worse.
This is stressing me out. I need to go for a smoke.
Oh, jeez.
Can I go out for some air?
We cannot allow that. That's against our hospital policy, and smoking really isn't going to make your COPD
I just want some
any
air. I
better.
don't want to smoke. I just want some air. I just want to go outside and be a part of the air.
Well, let's see what your doctor comes in and says, and then we can discuss discharge planning and possible smoking cessation.
How long am I going to have to stay in here? I've already been in here for a week.
Quick.
You get to go home. I get to stay here.
I am not able to tell you the exact stay, but your doctor again will be able to discuss that further with you. We want to discharge you when it's safe for you to go home, when your breathing is a little more adequate.
Okay. Is the doctor coming in soon?
Yep, the doctor should be in shortly. I'll go page her.
Thank you.
God, I always take a flower. Okay.
Hi, I'm Dr. Condon.
Hello.
So I've got the results from your x-ray, and it looks like your COPD is getting worse. So we're going to send you home with an albuterol inhaler, and that's only for emergencies. You're not supposed to use
I
it
have
every
one
day.
of those at home. I use it every hour.
Every hour? Okay. So you only use it when you have an exacerbation of your COPD.
What's an exacerbation?
So when you can't breathe, you feel like your chest is tight, use your albuterol inhaler, and that will help with those symptoms.
Okay.
I'm also going to schedule some pulmonary rehab for you. We're going to do a PFT, and then I'm going to send you home with a breathing treatment also. That's an everyday thing that should help with your symptoms.
Once a day?
Once a day, yes. Any questions?
I don't even know.
I don't think
We'll
so.
figure it out.
I can still smoke, right?
No. We do want you to quit smoking as much as possible.
I can't
That will-
quit cold turkey. What are you going to do for me?
We can get a nicotine patch for you. I can
I
order
tried
some-
that. That does.
No, what about nicotine gum?
I don't. That
Have you
stuff's
tried that?
gross in my mouth.
You've tried that before?
That's. Would you want to put that in your mouth and chew on it?
I'll do it if you do it.
What else do you got?
I can look into that and get back to you, but we do want you to quit smoking. It will help with your symptoms.
It is just really hard because everyone in our family smokes. But maybe we can all work together and.
Yeah, as a
I saw a
family.
commercial on TV about a pill that you can take, and it doesn't seem like it takes too long.
What pill, sweetie?
So you're referring to Chantix, right?
Yes, that's
Okay.
the one I saw.
I'll have to look into that because it does have some serious side effects that could potentially be harmful, and I'm not sure what medications you're currently on. So I'll have to go through and make sure there's no adverse effects, okay?
I just
But
think
will
that
look
would be
into
easier to take one more pill a day.
Let the
instead of-
doctors help you, okay?
If that's something you're interested in, we can look into it though.
I know you're anxious, okay?
Yes, I just want to go outside for a minute.
No.
Okay, so I'll let the nurses come in, okay?
Okay.
Thanks, bye.
So, Mom, I was thinking, Dad, maybe we can do this together. Let's all quit together. We can maybe get other family members, because I don't wanna get COPD.
I don't
wanna
either.
be like
Do
me.
you think?
God has a plan
I
for all
don't
of us.
have time to do this. So
I don't
can
know,
we,
man.
can we
But what
quit
if
together?
God doesn't want us to stop smoking?
Why would you say that?
What if, I mean, he put me on this earth, he had me start doing everything that I'm doing right now. So maybe I'm just supposed to be like this the rest of my life and die happy.
I don't think God would do that.
Are you happy right now?
Well, I'd be happier if I could go outside and have a cigarette.
Well, let's start now with quitting smoking.
Well, the doctor's supposed to look into something, some kind of a pill. Maybe
Yeah.
that'll help out.
Yeah.
That'll be easier to take.
Don't you want to see your grandkids grow up and stuff like that?
Are you gonna have any soon?
Now's not the time for this question.
Okay. We'll move on.
Alright, well, whenever the nurse gets here, I guess. Oh, there she is.
Okay, so I just got discharge instructions from your doctor, and
Am I going home now?
we're not discharging right now. There's just a few more things that we want to go over, and we want to make sure you're in a little more stable condition before we send you home. So your doctor talked about some diagnostic tests that we want to do. Did she went over your x-ray with you?
Yes, she said it was much worse than the last time.
Do you have any questions regarding that?
I don't really know anything about chest x-rays, so I guess not.
Okay, well, the chest x-ray will show more of an overinflation of the lungs, maybe a little bit more enlarged. So that's how they can tell that it's
Getting
getting worse. We're still going to run the pulmonary function test for you. We are going to have you start an incentive spirometer. How this works is we will set a goal, and you will actually inhale in slowly. A lot of people think that you're supposed to breathe out. But, so we'll start your goal low, and then what this does is it teaches you to open up your lungs while you breathe. And so when you go home with this, what we like to tell people is when you're watching TV, when the commercial comes on, do it 10 times when commercials come on, and then when your show comes back on, you can put it down.
Oh, she will be so good at that. All she does
I
is watch
love
TV.
I love TV.
Okay, so we're gonna have that.
How many times a day should she do that roughly?
I'm going to harm her to
You don't have
do
to do
it
it
as
all
many
day,
times.
all
No,
day.
you don't have to do it all day.
Just a couple?
Just a couple hours during the day, during commercial breaks, during your TV, while you're laying in bed at night reading. If you read,
No.
no.
I like to read my Bible sometimes when he's not there.
Okay, well, while you're reading your Bible, when you finish a passage, you can set it down and do it a couple times.
Okay, we can
So
work on that.
that's one thing. Your doctor discussed medications for you. So she
Yeah, the
says,
inhaler like I have at home that I use every hour.
yes, your rescue inhaler should not be used regularly. It should only be used during exacerbations of your COPD.
Well,
Like,
I think I'm having an exacerbation every day, like every hour.
okay, so your doctor also prescribed you in-home nebulizer treatments, which albuterol goes in there. Albuterol is a bronchodilator that's going to help open up those airways and help you breathe a little better. The nebulizer, all you do is you just breathe in the misty solution.
I
And
think
breathe it out.
my grandson has one of those for asthma.
Yes, it's also used for asthma, emphysema, and COPD. Your doctor also brought up that she would really like you to try and quit smoking.
We were actually just talking about that.
We're gonna quit as a family.
Oh, that's good. When you have family support, sometimes it makes things a little bit easier.
We'll try. We're gonna do it together and see where it goes.
We'll pray every day that it will work.
You'll pray.
You'll pray.
You mentioned an interest in Chantix. That is something that, because it is an added medication and it can have interactions with your other medications, that's something you might want to bring up with your primary care provider
Okay.
after
I'll do
you
that.
leave the hospital, because our goal is to get you out of here in a stable breathing condition.
Okay.
The nebulizer, how often does she need to use that?
It is used, I'm not sure what the doctor is going to write for the prescription,
Okay.
Usually they're used about once a day, but they can,
I think
depending
that's
on,
what the doctor said when he was in here. Do you remember?
Mhm.
Okay, I think so.
yeah, depending on your symptoms, sometimes it's changed to 2 times, 3 times a day. So we'll see what the doctor writes for that. Do you have any other questions for discharge information?
I don't think so. I just want to go home.
No, I'm good.
I'm good.
Okay, well, we're gonna start working on your discharge. We're gonna get you down for those pulmonary function tests, and then hopefully get you out of here breathing good.
Thank you so
Okay.
much.
Thank you.
You've been such a help.